A long life is a life of constant awareness, even of the smallest rituals. This was said by Dr. Shigeaki Hinohara, one of Japan's longest-living and most respected physicians. He didn't speak in grand speeches or miracle formulas. He spoke of rhythm, of breath, of paying attention, and perhaps that's the first step we forget as we grow older, noticing. Not just the big changes, the diagnosis, the fatigue, the fall, but the quiet habits repeated in silence that shape our health day after day. We often think health begins with what we eat or how much we move. And yes, food matters. Walking matters. But there's a small room in every house, a room with cold tiles, white walls, and a door we usually close behind us that tells more about our health than we imagine. The bathroom. And no, this isn't about hygiene or products. It's about rituals, postures, breathing, tension. What we do in that quiet space, often half awake or half rushed, leaves marks on our blood pressure, on our digestion, on the muscles of our legs, on the strength of our pelvic floor. Have you ever felt dizzy after getting up from the toilet, or weak in the knees? Have you noticed how sometimes a simple visit to the bathroom leaves you more tired than before? These are not signs of aging. They are signs of imbalance, of small habits that over time take a toll on the body. But because they happen in silence, and because no one talks about them, we accept them as normal. They're not. They are avoidable. And today, we will talk about them. Dr. Andrew Weil, a pioneer in integrative medicine, reminds us that healing isn't about treating symptoms, but about observing patterns. How we begin and end the day. How we breathe when we move. How we sit. How we strain. That means the bathroom isn't just a place of relief. It's a space of revelation. It tells us what the muscles are doing. It tells us how the blood is flowing. It tells us whether the nervous system feels safe or under pressure. So in this video, we're going to explore 4 common bathroom habits that many people over 60 still follow. Not out of choice, but out of habit or lack of awareness. And these 4 habits? They might be quietly harming your energy, your digestion, your muscles, your balance. But the good news is, with small, simple adjustments, rooted in science, inspired by ancestral wisdom, you can begin to reverse their impact. No pain, no gym. Just small decisions made with care. Because healing doesn't begin with the body. It begins with awareness. And the bathroom of all places might just be the best place to start. There's a kind of stillness that heals, like when you sit quietly in the morning light with a warm cup of tea. But there's another kind of stillness that slowly weakens the body, one unnoticed minute at a time. That stillness often happens in the bathroom. For many older adults, going to the toilet has become a moment of escape, not just for the body, but for the mind. Some bring their phone, others linger out of habit, tiredness, or discomfort. But what seems harmless can quietly disrupt circulation, pressure, and nerve function. Especially after 60, sitting for too long on the toilet does more than just mark time. It constricts blood flow to the legs, places strain on pelvic nerves, and over time, increases the risk of hemorrhoids and vein problems in the lower limbs. The body isn't designed for this type of prolonged pressure. As we age, the tissues in our legs and pelvic area lose some elasticity. Veins become more sensitive, blood doesn't circulate as freely, and nerves get compressed more easily. Sitting too long, even just 5 or 6 minutes at a time, can be enough to cause temporary drops in blood pressure. That's why some people stand up after a visit to the toilet and suddenly feel a wave of dizziness, or even risk fainting. It's not just age, it's blood that hasn't had space to move. In many traditional cultures, this doesn't happen. In parts of Asia and rural regions of the Mediterranean, elders still squat instead of sit. It's not just a cultural detail, it's a position that shortens the time needed for elimination, reduces strain, and supports the body's natural mechanics. When you squat, the colon aligns better. When you sit for too long, the opposite happens. And over time, what should be a moment of relief becomes a moment of silent wear and tear. There is a simple rhythm to follow. If there's no urge after a minute or two, the body is probably not ready. It's better to stand, walk a little, and return later. Waiting in that position, even with good intentions, brings more harm than help. And if you can, place your feet on a small footstool. That simple elevation changes the angle of the pelvis and allows the colon to empty with less effort. Because here's the truth. Your legs are not made for waiting. They're made for walking, for moving toward the garden, toward the sun, toward life. Keep the bathroom short, keep the blood flowing. That small habit done daily might just be protecting your heart and your balance far more than you realize. There's something poetic about early morning. The quiet, the light filtering through the window, the first sounds of the day. But there's also something hidden beneath that silence. A subtle shock the body receives that few ever speak about. It starts at the feet. Imagine this. You've just woken up. Your body is still warm from sleep, your circulation slower, your blood pressure still adjusting. And then, bare feet touch a cold tile floor. That sudden chill may feel harmless, even refreshing. But for an aging body, that small shock can create a cascade of invisible reactions. The blood vessels in your feet and legs constrict. The body tightens. Your balance, already more fragile with age, becomes just a bit less steady. It's called vasoconstriction, a natural response to cold where blood vessels narrow to preserve heat. In a younger body, the reaction is swift and often unnoticed. But for older adults, especially those with reduced circulation, joint stiffness, or peripheral neuropathy, it can trigger more than a shiver. It can increase the risk of falling. It can tighten the joints that are already inflamed. And for some, it can lead to a slight rise in blood pressure, or paradoxically, a drop, depending on how the nervous system responds. In Okinawa, where some of the longest living people in the world reside, there's a quiet tradition. Even inside the home, elders wear light wooden sandals or soft slippers, especially during humid or chilly months. Not for comfort, but for protection. They understand that warmth starts at the feet, and that warmth means flow, stability, safety. That same wisdom exists in many ancestral cultures. Feet were always tended to, warmed by a fire, wrapped at night, covered at dawn. It wasn't vanity, it was knowledge. The feet anchor not just our balance, but our nervous system. Cold on the feet is not just a matter of sensation, it's a trigger, a message that travels up the spine and tells the whole body to brace. And when a body is already tired or fragile, that extra tension adds up. That's why a pair of warm, non-slip slippers beside the bed is more than a convenience. It's a signal of self-care, a way of telling the body, we are safe, we are steady, we can begin the day without surprise. Because your feet are not just the bottom of your body, they are the gatekeepers of your balance. When they are warm, your body moves with trust. When they are protected, your legs respond with strength. And when strength begins in the first step of the day, everything else becomes easier to face. Before we move on, take a moment to notice something. If a small change like warming your feet can protect your balance, what other quiet habits are shaping your day without you realizing? There's something waiting in the pinned comment, a simple idea that might shift the way you think about daily routines after 60. When you finish this part of the video, have a look. It's written for those who believe that even the smallest gesture can carry healing. Some things in life ask for urgency. A pot boiling over, a ringing phone, a grandchild calling your name. But the body, especially as it ages, asks for something else. It asks for rhythm, for patience, for listening. Nowhere is this more evident than in the quiet ritual of a bowel movement, a moment we rarely speak about, yet one that holds deep influence over strength, balance, and even dignity. With age, many begin to feel that their body no longer responds on cue. That elimination becomes slower, more stubborn, or less predictable. And so, in frustration or fear of constipation, fear of not going, we push, we strain, we hold our breath and try to force what should come with ease. But this urgency, this pressure, weakens something more than just the moment. It weakens the very muscles that hold us up. The pelvic floor, a basket of muscles beneath our core, does more than support elimination. It supports posture. It helps regulate balance. It connects to the abdominal wall, which is why those who strain repeatedly over time often feel back pain, a weak midsection, or trouble standing for long. What's more, straining doesn't actually speed up the body's process. As we age, the rectoanal coordination reflex, the inner rhythm that tells the body when it's time to release, can become slower. Forcing it doesn't help. It confuses it, like yelling at someone who's already doing their best to listen. In ancient Ayurvedic tradition, the act of elimination was never rushed. It was seen as a sacred moment, the body's way of releasing what no longer served it, a time to breathe, to align, to let go with grace. And in that wisdom lies a truth that science now confirms. When we exhale slowly, when we brace the abdominal wall gently instead of bearing down, when we focus our attention and remove distractions, the body cooperates. It softens. It opens. So often we bring a phone into the bathroom, a magazine, a habit of distraction. But in doing so, we also distance ourselves from the body's message. We rush the end of the process, just as we rush the beginning of the day. But the body is not a machine. It is not a button to press or a tap to turn on. It is a conversation, deep, quiet, patient. And if you rush the end, you miss the message. So the next time the body speaks, not with urgency, but with invitation, let it be a moment of stillness, not tension, of breath, not pressure, of cooperation, not command. Over time, this gentle attention becomes something greater than ease. It becomes strength, the kind of strength that comes not from force, but from respect. And with respect, the body responds. Even at 70, even at 90, it's still possible. It's always possible. There are messages the body sends in whispers, a soft twinge, a quiet reminder, the feeling that you might need to go, but not urgently. So you wait, finish the news, let the kettle boil, try to fall back asleep. You tell yourself it's nothing, you can hold it, but over time these small delays, this quiet ignoring, begins to change something deeper than just a bladder. In youth, the urge to urinate is clear, firm, and usually honored. But as we age, the relationship becomes more complicated. We may not feel the urge as strongly, or we feel it, but we don't trust it. Or worse, we train ourselves to ignore it, out of convenience, out of habit, out of forgetfulness. Yet this habit has consequences far beyond a full bladder. When urine is held for too long, especially first thing in the morning, when the bladder is already full from the night, pressure builds, not just in the bladder wall, but in the surrounding muscles, ligaments, and organs. The pelvic floor, which acts like a sling to support the lower abdomen, absorbs that tension. Over time, this strain can weaken its integrity. It can affect posture, create instability in the hips, lead to discomfort in the lower back. And it often happens without any dramatic warning, just a slow shift in how the body stands, walks, or balances itself. In the world's blue zones, places where people regularly live into their 90s with clarity and movement, morning routines are sacred. Elimination is not an afterthought. It's a ritual, often done with the rising sun or just after gentle movement. It's a way of honoring the body's rhythm, of aligning with its signals instead of silencing them. Some elders in these regions use light abdominal massage when the urge is weak. Others sip warm water or take a short walk near the garden before visiting the toilet. They understand something many of us forget, that elimination is not just waste removal. It's a nervous system function, a muscular event, a mirror of how well or how poorly we've been treating the signals within. That's why, especially with age, it's important to listen, not with panic, not with fear, but with trust. If the urge to urinate appears in the morning, even faintly, respond with care. Let the body reset its rhythm early. Let the pelvic floor find its release. And in doing so, you protect something far greater than comfort. You protect your foundation. Because ignoring the urge to go is like ignoring the base of a house. Sooner or later, the structure shifts, and what seems minor today may become imbalanced tomorrow. But there's power in the small things. And in the quiet hour of dawn, when the world is just beginning to stir, the way you respond to your body's whisper might just set the tone for how steady, how upright, how strong you remain, not just for the day ahead, but for all the years to come. Every small act repeated wisely extends life. Dr. Shigeaki Hinohara's words do not demand attention. They whisper. They don't promise miracles. They invite reflection. And perhaps that's what growing older truly asks of us. Not urgency, not reinvention, but a deeper noticing of the ordinary. A return to what we've always done, now seen with gentler eyes. The bathroom is one of those quiet spaces where the body tells its story, but because it's behind a closed door, because it's tied to habits we learned young and never questioned, we rarely reflect on what happens there. Yet for someone over 60, those brief moments, stepping on the floor, sitting, releasing, rising, hold more power than we imagine. These aren't just routines. They are tests of balance, pressure, control. They're mirrors of our circulation, our nervous system, our posture, even the state of our muscle tone. When the body changes slowly, it's easy not to notice. You might feel a little more tired after a visit to the bathroom, but brush it off. You might feel a faint pressure in the lower back or forget the last time you emptied your bladder fully in the morning, but decide it's just part of aging. But aging is not a sentence. It is a shift, and every shift can be softened, guided, if we pay attention. Health is not just in the food we prepare or the steps we take in the garden. It's in the warmth of the floor beneath our feet, in the few seconds we wait before responding to the urge, in how we sit and for how long. It's in the way we breathe when the body asks to release. It's not dramatic, but it is daily, and what is daily becomes who we are. Too often we imagine strength as something built in the gym or measured by how far we can walk. But the body's strength, after 60 or 70 or 80, lives in the small, in standing up without feeling faint, in keeping the bladder relaxed, the core engaged, the legs steady. These things begin in the most private of spaces, in silence, in habit. Dr. Andrew Weil reminds us that the nervous system never stops responding, even when we're alone, even when we're doing something as ordinary as relieving ourselves. The body listens to the message we send, whether we're rushing, tensing, ignoring. And when we respond with care, even in those unseen moments, the body often responds with balance. So what if today is not about doing more, but doing one thing differently? Not for anyone else to see, not to check a box, but because you understand now that even the smallest rituals, the ones done barefoot with sleepy eyes in silence, shape your future. Ask yourself quietly, what do you do each morning that your body endures instead of enjoys? What habit is wearing at your energy, your stability, without ever making a sound? There's no need to answer out loud. The body will hear your decision, and in time it will speak back, with strength, with ease, and with gratitude. And before you go, let me ask you this. What if one quiet thought, waiting just beneath this video, held something meant for you today? You've come this far. You've listened with care. Perhaps now is the right moment to scroll down and check the pinned comment. Not because it's urgent, but because sometimes the smallest things placed gently in our path carry exactly the nudge we needed.